Well, this is what Trump had to say about Robert F. Kennedy Jr. during a campaign rally in New York last month.
I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
Well, joining me now is former White House COVID-19 response coordinator, Dr. Ashish Jha. He is the Dean of Brown University's School of Public Health. Good to have you with us, Doctor.
Thank you for having me here.
So RFK Jr. has certainly made all sorts of wild health claims. He also has some interesting ideas on cutting food additives out of certain products. But I want to start with those wild claims. Some of the claims he's made, including that he said fluoride, which of course is in toothpaste, in water. He says it's an industrial waste. He's also said that COVID-19 was ethnically targeted to impact Caucasians and Black people while sparing Jews and Chinese people. And of course, he's said on multiple occasions that vaccines cause autism, which is obviously a thoroughly debunked claim. What is the risk, Doctor, when you have someone like that who over many years has pushed so much misinformation heading up a health and science human services department?
Yeah, I think this is a very, very dangerous choice for the health of the American people. Look, there is a way that we have made progress in our country and around the world over the last 100 years, last 50 years, through scientifically, rigorously testing medicines and vaccines. And this puts all of that at risk. He has ideas that I think belong on bumper stickers, but they do not pass the rigorous analysis test. But I always remind people, this job as HHS Secretary is not just about overseeing vaccines and fluoride and raw milk as much as it is those. He's going to oversee Medicare. He's going to oversee the insurance program for all seniors in America. He and his people are going to determine what medicines all Americans have access to, whether women get their mammograms paid for free or not. Like, this is an incredibly important job, and he is not the right guy for this job.
And in terms of the anti-vaccine push, we have seen in recent years decreasing rates of childhood immunization here in the US. It's already been flagged as a major concern. Can you just explain why a drop in immunization is significant?
Yeah, look, this is really a problem. We know for certain diseases, like take measles. Thankfully, we don't see a lot of measles anymore because children have been vaccinated. You have to keep the population vaccine rates above 95% to keep measles out of a community. Even if it drops down to 90 or 85, we start seeing outbreaks. That is what we are seeing in certain communities, spread largely by people like RFK Jr. who like to undermine confidence in vaccines. Again, I think his worldview on these things sound good as long as you don't think about it, but they don't live up to rigorous analysis. And that's what makes him so dangerous.
Yeah. In terms of some of the support he has got some support for his ideas around getting rid of food dyes and additives. He has said on the record, he's asked the question, why do we have cereals like Fruit Loops in our country that have 18 or 19 ingredients, and you go to Canada and there's 2 or 3 ingredients approved? Could reassessing what is in our foods help?
Yeah, look, no question about it. There are problems with processed foods. I mean, there are things he brings up, which many of us in public health bring up. There's a lot of problems with processed foods. Obviously, they have driven some of the obesity that we have seen. I think a careful look at that would be a good thing to do. Now, in the previous Trump administration, there seemed to be very little interest in looking at those things, but I think that is fine. I think the much broader issue here is how are we going to make those decisions? And when we look at additives in foods, how are we going to decide whether something is safe or not? We're going to have to rigorously test it using scientific methods. That's how we make decisions. And he is not someone who has shown any evidence of being committed to that process. So absolutely, let's look at all of those things, but let's do it in a way that is rigorous and scientific so we can actually know what's healthy for people and what's safe and what's not.
Dr. Ashish Jha, we appreciate your time. Thanks so much for joining us.
Thank you.